a tongue tie release is not a magic pill or an immediate fix. It's one piece of a larger puzzle. Welcome to Mothering from Within, the podcast where we dive into the heart of parenting during those magical yet challenging first few years. I'm Kaili Ets, a mama of two, a pediatric occupational therapist, and your guide on this beautiful journey of motherhood. Every week, we explore the wonders and hurdles of motherhood with curiosity, we gain clarity around our babies, and find the courage to trust our instincts. If you are a mama who wants to do motherhood your way, confidently, courageously, authentically, then you are in the right place. So grab a cup of tea, tuck those little ones in for a nap, or bring them along for the ride. It's time to get curious, gain clarity, and unleash your courage to do motherhood your way. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or healthcare provider. Hey mamas, welcome to another episode of the Mothering from Within podcast. Today we're diving into a topic that's incredibly important, but often misunderstood: tongue ties. If you've ever struggled with your baby's latch, feeding difficulties, reflux, or disrupted sleep, then you'll want to stick around for this episode. Tongue ties or ankylosing are more than just a small oral issue. They can have far-reaching impacts on feeding, sleep, and even your baby's overall development. In today's episode, I'm going to talk about what exactly a tongue tie is, how to identify the signs, and how it might be the underlying cause of feeding challenges, reflux, sleep disturbances, and developmental issues. So let's start with a basic understanding. Everyone has a lingual frenulum, that little string-like tissue under your tongue that connects your tongue to the floor of your mouth. It's completely normal to have a frenulum, as it helps anchor the tongue. However, when the frenulum is too tight, thick, short, or too far forward on the tongue, it can restrict how the tongue moves and functions, and that's when it's considered a tongue tie. For your baby, this restriction can make it difficult for their tongue to move freely, to elevate up to the palate or the roof of their mouth, which is important for feeding. It also affects their ability to cup the nipple, swallow, and then it can also affect things like speech and intro to solids. If the tongue is restricted in its movement, it can create a ripple effect that affects many aspects of your baby's well-being. What's fascinating is that the tongue is one of the first structures to develop in utero, and it starts to practice its movements and things like sucking quite early on. Your baby's tongue is practicing how to latch, suck, and swallow well before they're even born. So, when there's a restriction due to a tongue tie, it means that from very early on, your baby may have already been compensating for those restricted movements. That's why, after a tongue tie release, it often takes longer than expected for babies to relearn how to use their tongue efficiently and to develop new movement patterns. So, how do you know if your baby might have a tongue tie? Here are some key signs to look out for, particularly during feeding. Difficulty latching or staying latched. This is a common sign of tongue tie. This difficulty with latching onto the breast or the bottle. Your baby might slip off easily, pop on and off, need frequent breaks, or even have a weak or shallow latch, which can be quite painful for you as a breastfeeding mama. It might also take them much longer to feed, and even then, they may still seem hungry. Or on the flip side of that, they might actually fall asleep really soon after the feed starts because they're just so exhausted from trying so hard. Gulping, clicking sounds, and air intake are the next ones. If your baby makes clicking or smacking sounds while feeding, that can be an indicator that they're struggling to maintain suction. You may also notice that your baby is swallowing a lot of air or they have the milk bubbles by their mouth, leading to symptoms like more need for burping, spitting up, gassiness, and discomfort after feeds. I want to dive deeper into how tongue ties can contribute to reflux. One of the biggest misconceptions is that reflux is just about stomach acid contents coming back up. But there's often more going on. When your baby has a tongue tie, the restricted tongue movement can make it difficult to create a proper seal while feeding. This results in your baby swallowing excess air. And when that swallowed air mixes with the milk in the stomach, it can create sort of like a pressurized container in there. That pressure needs to go somewhere, either up or down, which is why you often see spit up or vomit, or sometimes you'll see poop explosions. This could also cause discomfort, gassiness, and even things like arching during feeds. Reflux isn't always about too much stomach acid, like your doctor might let you believe. It's often a symptom of something else going on, like poor feeding mechanics. Babies with tongue ties may also experience other digestive challenges because the tongue plays an essential role in digestion. Normally, the tongue helps with a process called peristalsis. And this is really the first part of digestion. And this peristalsis is the rhythmic movement that sort of moves the food through the digestive system. If your baby's tongue isn't able to function properly due to something like a tongue tie, it can impact how well milk or formula is moved through their digestive tract. This can lead to symptoms like gas, constipation, and yes, even more reflux. The lower esophageal sphincter, the LES, which is the valve that is between the esophagus and the stomach, is still developing in babies. So any increased pressure from air intake can cause more stomach contents to come back up into the esophagus. So if you notice that your baby is spitting up frequently, but also seems really uncomfortable, gassy, fussy, or is having difficulty with bowel movements, it's worth considering whether a tongue tie could be at play. If you're noticing any of these signs, it's really important to take a closer look at your baby's symptoms. I've put together a free tongue tie symptoms checklist that you can download using the link in the show notes below. It's a quick and easy way to track what you're seeing and to start connecting the dots between feeding, reflux, sleep, and other symptoms that might be related to a tongue tie. Tongue ties don't just impact feeding. They can also affect sleep and development. Babies with tongue ties often struggle to feed effectively and may not be able to get a full feed, leading to more frequent wakings due to hunger. They might be waking up every couple of hours because their tummy just isn't full, which can disrupt not only their sleep, but also yours. Additionally, since their tongue function is limited, they may struggle with mouth breathing, which is less efficient for breathing in general, but also for getting into a deep sleep. Babies, and really humans in general, are designed to be nose breathers, and mouth breathing can lead to fragmented sleep, snoring, and even conditions like sleep apnea in some cases. The function of the tongue is closely connected to the rest of the body. Babies with tongue ties often develop compensatory patterns due to their restricted tongue movement, which can lead to body tightness and tension as well. In some cases, this tightness may manifest as something like torticollis, where your baby has a preference for turning their head and rotating their head to one side, or has difficulty with head and neck movements. This can further affect their ability to feed and to sleep comfortably. When the tongue isn't functioning properly, it can also impact oral motor development, the way your baby's tongue, lips, and jaw move together. As your baby grows, this could affect speech, swallowing, and even facial and dental development, as the tongue really helps shape the palate and the structure of the mouth. Now, One of the most critical parts of diagnosing a tongue tie is a functional assessment. This goes beyond just looking at the frenulum. A proper functional assessment will involve feeling how the tongue moves and also determining if there's any tension or tightness in that lingual frenulum. It's really important to know that sometimes what appears to be a tongue tie might not actually be a tongue tie at all. Restricted movement can actually be due to tightness elsewhere in the body. Here's why. The tongue is connected to the toes through a network of fascia, which is just a layer of connective tissue that surrounds muscles, nerves, and organs. If there's tightness anywhere along this deep front fascial line, it can impact the function of the tongue. Another aspect to consider is cranial nerve compression. Many cranial nerves exit through small spaces between the bones of the skull and innervate the muscles of the face and the neck and the tongue. If there is any compression, any tightness, or cranial molding of these different bones in the head, it can impact the function of these nerves and in turn affect how the tongue moves. That's why a functional assessment is so important. It's not just about looking at what's going on in the mouth, but considering how the entire body is contributing to the function of the tongue. So let's talk a little bit about what happens after a tongue tie release. Once the frenulum is released, it will begin to grow back because remember, the frenulum's purpose is to anchor the tongue to the floor of the mouth. What we aim to achieve through wound care and stretches is to ensure that the new frenulum grows back in a longer, stretchier, and more flexible way than it was before. This helps to ensure that your baby's tongue has more range of motion in all directions, leading to more efficient feeding and better overall function. It's crucial to perform those gentle stretches and exercises as recommended by your provider to prevent any kind of reattachment or scar tissue formation. Without proper wound care, the frenulum could grow back in the same way as it was before the release, or even in a tighter way, which is often called quote unquote reattachment, and it restricts the tongue's movement all over again. Lastly, I want to touch on a really important point. A tongue tie release is not a magic pill or an immediate fix. It's one piece of a larger puzzle. All too often, I hear from mamas who have had their baby's tongue tie released, expecting it to resolve feeding or reflux issues right away. But without any pre release preparation or follow up exercises, they're often disappointed when it doesn't resolve all the issues. Imagine your baby has been compensating for restricted tongue movement for weeks or months. It takes time, oral exercises, suck training, and sometimes body work to help your baby relearn how to use their tongue properly and to build efficient movement patterns. So, when considering a tongue tie release, it's so important to take a holistic view and to work with a team of professionals who can support every aspect of your baby's journey, from oral motor function to body tension to wound care and feeding support. I hope today's episode has given you some clarity around tongue ties and how they can affect feeding, reflux, sleep, and even your baby's development. Remember, it's all about looking at function over structure and recognizing that there are many pieces to this larger puzzle. Make sure to download your free tongue tie symptoms checklist using the link in the show notes below to help you track your baby's symptoms and understand how they sort of start to connect. And I'm excited to share that in our next episode, we'll have a special guest expert joining us. Together, her and I will dive deeper into the impact of tongue ties on development and how to support your little one holistically. Thanks so much for listening, mamas. If you found this episode helpful, please subscribe, leave a review, and share it with other mamas who could benefit. You're doing an amazing job. See you next time. Thanks for joining us today on Mothering from Within. If today's chat sparked something inside of you to explore your motherhood journey deeper, the Mothering from Within Collective is waiting with open arms. This program offers an intimate, high-touch coaching journey designed to empower you with the confidence and clarity to embrace motherhood on your terms, free from guilt. Get curious about your parenting values, gain clarity on your baby's sleep, development, and more. With comprehensive courses, one-to-one support, group Q&As, and a nurturing community. This is your invitation to join a community of mamas doing it all their own way. Supported, seen, and held. Visit the link in the show notes to learn more about the collective and how we can walk this beautiful path together. Until next time, stay curious, embrace clarity, and let your courage shine.